So I highly encourage you to think about SMART goals for every rotation during your residency. SMART stands for S for specific, basically something that has clear and narrowed meaning. M for measurable, so that you will be able to know if you achieve your goal or not by the end of the rotation. A for achievable, something that you can actually do. And then R for relevant, read and study stuff that are related to your rotation. And then T for timed. So for example, one goal would be like, by the end of this 2-week inpatient rotation, I would like to finish all the MICSAP questions related to the main diagnoses of the patient I will take care of during these 2 weeks. So you set a time, you set specific goal that is narrowed and you can actually achieve, hopefully. And also, as part of the practice-based learning, which is one of the 6 core competencies, always seek feedback from your friends, from your attending, look for evidence-based medicine, and also try to make use of the available technology. So before we round, I expect that interns already saw all their patients, discussed what is going on with them, with the senior, and be ready to round by 9 a.m. in the morning. And of course, the earlier the better, so that we can have more time for teaching. Sometimes I do the teaching sessions in the afternoon, but anyways, I think if we're done early with rounding, it's always better. Communicating with the senior is really important, important for patient care and for the senior's development as a supervisor as well. Everyone should be on the same page when it comes to assessment and management plan. Seniors also are expected to communicate with the interns if they put orders or change the management of the patient taken care by the intern. So please avoid surprises during rounds. So we mostly do bedside rounds, but sometimes we start by discussing all patients on table, also known as table rounds, and go and see select patients together. The patients I prefer to see together are those with what I call the 4 S's. Those who are sick, those who are shipped in, meaning newly admitted patients, those who are going to be shipped out, meaning they're about to be discharged, and those with diagnostic uncertainty, meaning those with something wrong going on. Also, pay attention to the discussion, even if it's not your patient. Get engaged in discussions. Do not hesitate to ask questions. Be organized in your presentation and follow the SOAP structure. And at the bedside, introduce the team to your patient and show us your ownership of the patient and your communication skills. After rounds are done, quickly put your orders before lunch. Enjoy your lunch, continue your excellent patient care, edit your notes, and make sure they are updated and organized. Please avoid redundancy, avoid contradicting statements, and avoid all the statements that are not true anymore in your notes. Make sure all notes are signed before you leave or by 6 p.m., whichever comes first. Recently, I found that teaching sessions in the afternoon are probably better than early in the morning, but that might change. So we might most likely we will do the teaching sessions, later during the day before we leave, maybe around 2 or 3 p.m. Prepare good sign out for the covering team or for the night team. And when you go home and after you get some rest and refreshment, I'd advise you to read topics related to your patient's medical issues and to look up the things we discussed during round, so that every day you come in with more medical knowledge than the day before. Believe me, that's the best way to kind of solidify your medical knowledge. It's always good to read about the things that you have seen on the same day. I have special interest in physical exam skills and point of care ultrasound. So if you need any assistance with these 2 skills, please let me know. I will try to apply relevant physical exam and ultrasound skills when we do bedside rounds. Remember, we have 3 butterfly ultrasound devices, one for each floor team, so take advantage of that. Finally, in the second page of the expectations handout, you will find 10 interesting tips for successful residency. So read them and try to apply them, and I hope that you will find them useful. At the end of the week, I might ask you to fill a self-assessment tool that I created that you can also find in the same page. We will use this for the end of the rotation feedback session. So take some time to reflect on your performance and on what you need to discuss with me during the feedback session, which I always try to make constructive and specific. And I hope that I will be successful in making it really useful and informative feedback. All right, I hope this was useful. I'm really excited to work with all of you, give you some clinical tips, help you learn, and learn from you as well. Good luck, and I wish you all an exciting inpatient rotation. Go and shine, and remember, the sky is the limit. See you in the floors. Bye bye. Salam alaikum.